I'm really happy to introduce our next speaker, Vince Randazzo. He's a consultant to the National Down Syndrome Society in Washington, D.C., serving as a public policy advisor on research and healthcare-related issues and supporting the organization's advocacy initiatives. Vince has been an active volunteer advocate for people with Down syndrome, both nationally and also here in Charlotte. I don't know, many of you remember, but many years ago, Vince and his family lived here in Charlotte, and he was on the board of directors at that time for the Down Syndrome Association of Greater Charlotte. And he's also served on the board of the Lumine Foundation, back when it was called the Down Syndrome Research and Treatment Foundation. Since 2013, Vince has teamed up with NDSS to establish and raise over $300,000 for the NDSS Research, Innovation, and Discovery Fund, which is one of the partner sponsors for this information session today. So we thank them for helping us organize this. Through the fund, NDSS is able to support projects that expand the infrastructure for clinical trials related to treatments and therapies for people with Down syndrome, and develop partnerships with other communities such as Alzheimer's and autism in an effort to remove barriers to collaboration on research and advocacy. So thank you very much for being here, Vince.
Thank you. Thank you, Cam. It's, let me clip this on. I'm not good at managing lots of things in my hands. I hope this works. It is really wonderful to be back with and see some great old friends of mine. You know, when I think it was 2004, and it was just the Down Syndrome Association of Charlotte. We've become Greater Charlotte, which was a great accomplishment, by the way. But back then, I remember the board, we sat and met at the kitchen tables of each board member. We'd switch off every month, right? You probably remember that. We had no staff whatsoever. As a result, we also had no budget. Even more interestingly, when we tried to do events like this, we had very few people show up. So it's really amazing what has been accomplished since I left the board, and probably as a result of my leaving the board, because it's incredible. The current board, through the leadership of the current board, and the vision and the support and just the management skills and leadership skills of Catherine and her team. I mean, this Down Syndrome Association of Greater Charlotte is one of the best in the country. I will tell you that. I mean, people call and they want to know how, they want to know how they do it. They want to learn from them. And it's not just they're great at supporting you and families and people with Down syndrome, but they've done it in such a broad and inclusive way that they're a model for the rest of the country. So I congratulate them on that. So I didn't put any slides up. I handed a bunch of slides out to you because most of those slides, I'm not even going to talk about that stuff, but I wanted you to have some information about the National Down Syndrome Society, and I will give a copy to Catherine, and she can put them up, on the website. So you'll have those. As Cam mentioned, the Research, Innovation, and Development Fund. Excuse me while I flip through my papers here. Because, I'm not a researcher, so I got to make sure when I talk about this, I get the jargon correct, right? So she mentioned in 2013, NDSS established a restricted fund known as the Down Syndrome Research, Innovation, and Discovery Fund to support research and clinical infrastructure needs of the Down syndrome scientific and research community. With the resources from these funds, we are able to work with other national Down syndrome organizations, biomedical and clinical researchers, pharma companies, NIH, and local service providers, such as the Down Syndrome Association of Greater Charlotte, to help support, to do what we can to support the infrastructure for state-of-the-art clinical trials for new treatments and therapies. With that, we can also support Down syndrome research advocacy efforts that highlight developments in the area of Down syndrome research and missing gaps. And also, it helps us to formalize partnerships with groups like the Alzheimer's community to engage around the National Alzheimer's Plan, which is a great plan that you can get over at Department of Health and Human Services. It's up on their website. And then leverage funding opportunities, both public and private, for Alzheimer's and Down syndrome, and build additional support for that initiative among policymakers. And so an example, this is an example of what we wanted to do with this Research Innovation and Development Fund, which is when Dr. Sherman mentioned that she, had her DS 360 project, really wanted to go out and build support for this and get information into people's hands so they can get participants in this. She wanted to do these research weekends, go around the country and do this, but she needed a little bit of support to do that. And so we were glad to partner with her. This is our first one that we've done this year. We're going to do, our second one's going to be in Cincinnati in April, and we hope to do about 4 or 5 of these a year if we can basically find great partners like DSAGC and others to work with us and bring people together. So this has been a phenomenal thing for us. Why this was important to us, I remember also back in 2004, I went to a research conference, an NDSS hosted research conference in Denver. And there we had all of folks like, I don't know if Stephanie was there back then, but we had a lot of great researchers there doing 2 days of presentations on all, they had just finished the sequencing of the 21st chromosome, and there was a lot of great research being done, and they were doing presentations. And at the end of it, we talked about, all right, what, in 10 years, if all of this research leads to groundbreaking discoveries, how do we get this stuff to clinical trials? And there was a realization that the infrastructure, the Down syndrome clinical trials infrastructure didn't exist. And so, so one of the things, that, they all said, what's the most important thing that we need? There's a lot of things we need, but the most important thing is a patient registry. And so, well, now, thanks to NIH, we have one. We had talked about it for 10 years. How do we get it funded? Who runs it? NIH stepped up, provided the resources and all the support, and we're grateful for them to do that, for doing that. And so the next challenge, of course, after you get a patient registry established is, all right, now how do we get people to participate, right? It's great to have a registry, but if nobody participates, then it doesn't do much good. If you go to the NIH website on the registry, you'll see there's a goal. They want to get to 10,000 patients registered on the site. We're only at about 3,000 right now. And so we really need to get participation if we really want to have good partnerships with our healthcare providers and with our researchers so that they can really help develop the types of interventions and therapies that will make a huge difference in the lives of people with Down syndrome. So I want to encourage you all to participate in that, and I thank you for that. There are a couple other elements of that that also are important, things like, biobanks, and we talked about outcome measures, and I would point out that NIH is also helping us lead the way on all of those as well. They've been a wonderful partner in all of this. They just recently consolidated and started a brain bank there's a lot of, brain tissue samples. There's others out there that are working on other types of tissue biobanks, which are important. Our goal is to try to get those integrated and help our research community talk to each other through that. And, I mentioned, outcome measures. They did a wonderful job last year. NIH sponsored a whole bunch of series of committee meetings and a big conference, and they're continuing this with all of our top clinicians and researchers to develop clinical trials outcome measures, so that, where they're accurately trying to understand and measure, what these drug targets are intended to do. So we're very grateful to NIH for that. Let's see. Mentioned that. So there, in addition to that, so let me just mention about NDSS. I want to make sure all of you probably know about them, but you may not completely. So National Down Syndrome Society is a national advocacy organization. They advocate for the inclusion and the advancement and the values of all individuals with Down syndrome, and they do it and they do it throughout the life cycle, from birth all the way to, to aging. And, there's a chart in here that talks about this, and that includes things like education, economic self-sufficiency, community integration and employment, and healthcare and research. And so, again, this deck that I handed out to you has a lot of information on all of those areas. It's actually summarized, and a lot of this stuff is on the NDSS website, but my contact information is on the last page. So if you want to know more about any of these issues and the work that the National Down Syndrome Society is doing in these areas, feel free to email me. I'm happy to share all the knowledge we have with you. But again, our focus, the focus, of what I just wanted to briefly talk about is biomedical innovation and research. And I mentioned what we're doing with the Research Innovation Development Fund. There are a couple other really important issues that are out there that will improve or impact the ability of our clinical and research community to do great science. And so I want to mention a couple things. One is there's legislation in Congress called, it's called, depending whether you're in the House or in the Senate, it's got different names, but in the House of Representatives, it's called the 21st Century Cures Act. So this is a piece of legislation that actually passed the House of Representatives in July. It's currently being considered in the Senate, and we're hoping that, given how crazy the Senate is right now with everything, getting anything done there is going to be difficult, but we're kind of hoping that this is legislation that's got a lot of bipartisan support. We're hoping we can find a way to get the support there and get this legislation enacted before the end of the year. And I'll tell you what it does. And it's called the Cures Act, but I want to point out that it not only benefits patients with life-threatening diseases for which a cure is being sought, it will also benefit conditions like Down syndrome for which health outcomes and improvements are being pursued, so they may live longer, healthier, and more productive lives. And so this legislation isn't just about Down syndrome. In fact, it's not really about any particular disease or condition, but we at NDSS believe it has a lot of potential to expand support, funding, and infrastructure, particularly around clinical trials and drug discovery and development and technology that will benefit people with Down syndrome. So basically, the legislation seeks to modernize the research process from the discovery of clues in basic science to streamlining the drug and device development process to utilizing the power of digital medicine and social media at the treatment delivery phase. NDSS, like I said, is supporting this because we believe it will benefit people with Down syndrome in several specific ways. One, by helping to design more targeted clinical trials that can produce faster and more cost-effective results. The legislation will expedite the ability of Down syndrome researchers to translate recent discoveries about the genetic basis for cognitive and medical impairments associated with Down syndrome into real treatments and therapies. Second, for individuals with Down syndrome who live with co-occurring and secondary psychiatric and medical conditions, we believe the legislation will remove barriers to research collaboration and promote a coordinated interdisciplinary effort to examine their correlation and impact. Third, in seeking to remove barriers to collecting, analyzing, and sharing research and clinical data, we believe the legislation will help to develop a better understanding about the pathology of Alzheimer's disease in adults with Down syndrome and provide new insights into how best to treat all people with Alzheimer's disease, not just those with Down syndrome. And then finally, by supporting increased partnerships between government agencies such as NIH and FDA and private stakeholders, we think the legislation will provide significant new resources to support Down syndrome research and clinical infrastructure needs. But more importantly, it gives NIH a heck of a lot more money, which is always helpful to us. And speaking of NIH, they've been a wonderful partner to us. We hear a lot about, is NIH doing enough on the funding part, and I think Lisa explained a little bit the challenges that they have. And they have been we think they've been a wonderful partner in focusing those resources on the right areas where we have the best chance of being successful in terms of research. And so, our focus in the coming year is on working with NIH to see if we can get an increased commitment to fund some of the priorities in the Down Syndrome Strategic Plan or the research plan that Lisa mentioned, and she co-wrote. She wrote most of it. And she did an amazing job. If you ever get a chance to go, and I think was it in your slide, the link? Yeah, if you go to what's it called? The Down Syndrome Research Plan at NIH. Go to it, you'll see it's the most comprehensive strategic plan for Down syndrome research that exists, and it outlines a lot of short and long-term goals, and it's phenomenal. We were, like I mentioned, we were pleased with the things they did last year, both around identifying, helping creating these working groups and sponsoring this conference to identify these instruments that can assess Down syndrome clinical trial outcomes, and subsequent efforts to develop behavioral, cognitive, and physical measures. I also want to point out another great area where accomplishment with NIH is in November. They launched this new initiative to identify biomarkers in Alzheimer's and track the progression of Alzheimer's in people with Down syndrome. They're providing $37 million over 5 years to researchers to use brain imaging and fluid and tissue biomarkers in research in the hope that it will one day lead to effective interventions for all people with dementia. And of course, Lisa knows this is coming, but we still would love them to do more, right? So there's a couple areas of interest for us. Of particular interest in 2016 is the need to facilitate collaborative efforts to study the progression of Alzheimer's across the lifespan of people with Down syndrome. As noted in the research plan, there is a need for longitudinal studies to gather natural history data and to determine the effects of interventions. We look forward to working with NIH to find ways to support that objective. In addition, there's a growing need, and I think a lot of you will appreciate this, to improve the understanding, problem solving, and decision making around complex behavioral, mental health, and related medical conditions which affect individuals with Down syndrome, autism, spectrum disorders. Is an example of that. The research plan that Lisa put together does call for expanded research into co-occurring and secondary psychiatric and medical conditions. As one short-term objective, we would like NIH to commit to exploring the potential for research focused on the complex intersections of Down syndrome and secondary neurobiological, behavioral, and psychological conditions, with the goal of providing resources and support to individuals with Down syndrome and their families who are affected with such conditions. So overall, like I said, we have a great partnership with NIH, and we'd like them to do more, and we believe they will, and we're going to be working with them throughout this year to see what can be done. We've got a lot of great activity going on, and we are really grateful for all of you for being here. All of the work that's being done can't be successful without your participation. And to the extent that you have a lot of questions about all the great research that's taking place and the types of clinical trials and concerns about that, there are a lot of people. We wanted to bring the best minds together to help you address those concerns and get your commitment and buy-in to participating so that we can really make sure that our children, our family members, our friends with Down syndrome have the best opportunity at success at life, and that's our goal here. So thank you very much, and thank you to the Down Syndrome Association of Greater Charlotte.